USF is wonderful in that they expose you right away to interact and interview patients. So we have a course called Doctoring where you have a small group with 2 doctoring preceptors who are practicing physicians. So we learn a lot of doctoring skills, so patient interactions, how to interview a patient and get their history, so their HPI. So we have that once a week. We've got to interview standardized patients and get a lot of feedback from that and just get really comfortable with interacting with the patient in a very detailed way. We've also had opportunities to do a lot of shadowing experiences. So recently I got to shadow the trauma surgeons at Tampa General Hospital, and that was really great. We got to round with patients, we got to talk with the residents and interns and attendings. So that was a very valuable experience.
I've had an interesting experience working in our student-run clinic. I've had a patient since my first year, and I've been treating her regularly for her diabetes. And through this opportunity, I've counseled her on diets and different exercise activities. And just recently, she was able to get her hemoglobin A1C to a normal range, and we were able to reduce her diabetes medication. And that was very exciting as an introductory student to medicine because I was able to see how medicine and counseling and just speaking with a patient can actually make a difference in their life. That's one of the things that I was interested in as a pre-medical student, is actually working with the community members and just speaking with them and educating them. And I knew that that would make a difference in health, and seeing that opportunity as a medical student makes me really excited for my future as a physician.
One of my most instrumental experiences was at Texas Children's Hospital, one of the biggest for us in Houston. And there was a neonate about 2 weeks old that was getting some heart surgery done. And the prognosis wasn't good. And the family knew this. The kiddo was born at like 24 weeks, which is barely on the cusp of viability. But every day when we would round with the team, we'd tell the family, the blood values are this, the chemistries are this, we'll do these tests. And that kind of continued for about 6 or 7 days, where every day we'd come by and say, now we're going to try this antibiotic, now we're going to try this new drug. At one point, I think this is day 10 or 11, the mom very frankly asks us, are we going to continue to play with these numbers, or am I ever going to be able to take my son home? And the answer honestly was a no. And no one on the team really wanted to say that. But at the same time, I don't enjoy false hope. I think there's no place for that in hospitals. You can have optimism, you can have healing through prayer, you can have a variety of things short of false hope. And so in discussing with the mom, I told her 9 times out of 10, no. This is the data. These are the mean estimated survival curves. But our kiddo probably lasts on the shorter end of things. And so we had that conversation about how to prepare for impending doom of situation. And it was really an important experience to realize who people are that come into the hospital. They're not just there for us to train. They are real people, and they have real problems.
At our medical school, we have a course called the ambulatory clerkship, and it's a once-weekly clinic opportunity. And many of us have our own patients that we follow up with, that we schedule appointments for, and we go to other outside appointments with. And so this has been a great opportunity to interact with patients one-on-one as a second and first year medical student.